Hey guys! Sorry. Nadidinig niyo ba ako? I hope you can hear me, guys. I hope you can hear me. Hello, kung nandiyan kayo, say hi. Hello guys, welcome back to my YouTube channel. And this is our live stream and we're going to discuss about clinical adaptation. I hope you can hear me. Mag-comment naman kayo dyan if you can hear me because I cannot hear myself, to be honest, using this headset. Yes. Okay. Yeah. Okay. Somebody confirmed that somebody can hear me. Okay. Hello, guys. This is our live stream. I think this is our 12th live stream in my YouTube channel since I started, and we are just so fortunate enough um, to be joined by one of the best nurses here in Ireland. Okay, newly qualified as well for like less than a year. He's very excited. And actually, guys, this is like his spare time because he will fly to Edinburgh. Yes. Nako naman. Kasi buti na lang ano tayo. Uh, she he graced his period, his time to join us today. So, just gonna share this live stream, guys. Please um share this as well and like this video. 1 second. And by the way, guys, have you checked my latest post sa ating Facebook page? It created a bit of fiasco, to be honest with you, because somebody commented about, how difficult it is to live here in Ireland. So, ano bang thoughts niyo about it? I don't know if you already read about that. Say hi ka muna, Jack. What's that? Oh, okay, okay. Yeah, I forgot about it. So yeah, mag-hi muna tayo sa mga bisita natin. Hello, kay Nurse Rodolph. Hello. Kumusta? By the way, guys, pag nag-comment kayo, i-mention nyo kung saan kayo nanonood at the moment, okay? Para naman ma-shoutout natin kayo ng mas maayos, okay? Session ako, tumitingin ako dito, nandito ko sa isang monitor ko. So I'm just gonna share this to my Facebook page, if that's okay. Yeah? So yan, hello din kay Michael Smith. Hello. Yung guest natin may may private message sa akin. Natatawa lang ako. Nakakatawa naman. Nakakaya naman 'yon. Should I speak English ba? So yan. Guys, please don't hesitate to share this live sa inyong mga friends, especially sa mga nurses na papunta dito and they're going to have the adaptation or clinical adaptation. So we're going to talk about that. I know I made like several videos about clinical adaptation, my experience, and of course, yung interview ko sa previous overseas coordinator ng hospital namin. We were just so fortunate, guys. And if you haven't watched that, please do watch that, okay? I can't hear you, Anak. I'm just sharing this to my Facebook page. Yeah. So yeah, I think, teka lang, tapusin muna natin itong mga pa-shoutout natin. Yeah, kay Ditoy. Hello, Ditoy. Hello. Kay Michael Smith again. Kay Andre R. Hello, Nurse Raymond. Pa-shoutout po watching from the Philippines, Davao City. Hello, Andre. From Cagayan de Oro here, si Ditoy sa Cagayan. Kay JR Robis. Hello. What's up, Nurse Raymond? What's up, what's up? Guys, tell me kung medyo malakas yung background music Kasi sa akin parang okay siya. Maybe sa inyo medyo malakas. Medyo hinaan ko lang din ng konti. Ano? Yan. Okay. All right, guys. So, hindi ko na patatagalin to. Without further ado, guys, I would like to present to you talaga yan, our special guest for today's live stream. And that's no other than Nurse Cleven. Yon!
Hi, good morning to everyone. Good evening sa Philippines. Kamusta kayo?
Oo nga.
And hello around the world.
Yes, yes. Wala tayong papalakpak ngayon Cleven. Kasi
Ako tayo na
sira,
lang.
sira yung V8 natin, kaya palakpak na lang tayong ganyan. Uh, so yeah, we have 17,000 viewers. Hello guys, hello sa inyo.
Hi to 17,000 viewers.
Yes, I hope you can
Invite
keep
pa
with us.
kayo. Ayan.
Yes,
Ayan.
share nyo lang to guys, especially sa mga groups ninyo and for those who can, who can benefit with this video, right? O, kumusta ka naman, Cleven?
Okay naman. Nakapagpahinga na. I came from 7 week nights.
7
so,
nights.
nakapagpahinga ako. Yeah. So, nakapagpahinga naman ako yesterday. And then today, just preparing. Sabi mo nga kanina, pupunta akong Edinburgh tomorrow. So,
Yes.
kailangan i-enjoy natin.
Sana
We
may
have to
pa-Edinburgh,
enjoy it.
diba? Sana may pa-Edinburgh.
Kaya kung may nurse
Ilang
event sa
days ka
UK, 7 days.
7 days din. Boss, sinulit mo naka-annual leave ka din the next week.
Yeah, annual leave next week. Dikit sila.
Oh, that's good.
So, para mahaba-haba ka pahinga, na hindi mo ma-experience sa Pinas.
Oo, diba?
Dada ka pa ng butas ng karayong kung ano patatanungin sa'yo.
Totoo yan. At least dito, di ba? Basta off ka, pwede kang lumabas ng bansa for as long as you have the visa. Exactly. So, yun.
Right.
Mag-hi muna tayo. Ito, si Jezbeth Peñales. Hello, good days watching from the Philippines. Si Giselle din, watching siya from Medina, KSA. Yan, assalamualaikum. Tiffany from Quezon City. Hello, Tiffany. Si Glee Ligaya. Lagi ko ito nababasa, si Glee. Hello, good day everyone. And of course, we have hi Nurse Raymond and Nurse Even talaga. So, Nurse Cleven pala.
Nurse Cleven from Ireland. Initially, I was planning to do vlog but I cannot.
Oo nga, bakit ba hindi ka nag-vlog?
Ayoko na gawin yung mo. Ano na lang, sa'yo na yun.
Spotlight? Hindi naman, I can share the spotlight with you.
It takes time. I think it's not my bread and butter. Hindi ko siya parang sakto-sakto lang.
Well, anyway, alam mo you were able to do it naman by guesting my channel. So, diba?
I don't want to be bashed too much. Ayoko ng mga bashers.
Okay lang yan. Yan ang bumubuhay
sa mga bashers na ako sa totoong buhay. So,
talaga ba?
Hindi ko na kayanin pag sa social media.
Oo. Hindi, kailangan mo ng warriors. Mga keyboard warriors ko tawagin.
O, bibigyan natin ng pondo.
Guys, ready na ba kayo pag-usapan natin ng clinical adaptation? Just let me know in the comments down below. Kasi kung hindi pa, papatay na namin to. Ewan na lang.
True. So, kailangan ma-achieve natin ng 100 million subscribers.
100 million.
So, actually, I've watched your previous videos. I think it's 800. So, even though we're not that many at the live, hindi tayo masyadong marami
may
dito sa live.
Siya, actually.
May team replay.
Yes.
So, that's good. As long as they don't skip the ads.
Please don't skip the ads. Sayang naman yung
and subscribe as well.
Nakaperanggot na ng compensation natin. Alam mo, laki-laki kinikita dito. Wala masyado guys. Like, no.
It's good. Pero kapag nag-hit naman yung video mo, diba? So,
saka to be honest, I'm not after that naman. I just want to do this, to be honest.
Yeah, just for fun.
I'm not really after. Bonus na nga lang yun sumahod ako ng ganito, ng konti. Saka it's not, syempre naman, baguhan pa lang naman tayo dito. Saka yung number of subscribers natin, it's not that big compared to, other subscribers. But anyway, for as long as may mag-benefit dito sa videos na ginagawa ko.
That's right. And just enjoy what you're doing. I mean, kasi unlike sa Philippines na you don't have that much time. Here, really, you have all the time that you do whatever you want to do. So sometimes I found myself not doing anything and not being productive. Maybe that's why, I don't know.
Yeah.
So you must have some outlet to do especially if
Exactly.
you're single. But for the family guys, those with family, they have things to do. But if you're single, you have loads of stuff that you can do
Yeah. You have a lot
because
of
of the free time.
opportunities
Yeah,
here. You will not get bored actually. Well, it's up to you
it
naman how
depends. Yeah,
you,
it depends on the
yeah,
person. Yeah.
how you do it really.
How you do it. So if you are a workaholic, you can do more bank shifts or overtime if you want.
Yes.
But at the moment for me, it's difficult because I'm on a contract. Maybe after 2 years, where
Maybe. Yeah.
contract is not needed. Yeah,
Uh, because after 2 years, you will be granted like stamp four, and then you
stamp
will be at,
for no
yeah,
contract required.
you will be allowed to like change your employer
There, yeah,
as you wish
do
talaga.
overtime. Yeah.
Okay, guys. So without further ado, let's talk about the clinical adaptation. So, ano nga ba itong clinical adaptation? Okay, I'll just give a bit of overview about this pathway. No, so once you are done with your registration or with your qualification recognition, guys, you will receive your decision letter, and in the decision letter, you will have the option there or option, okay, option to take the clinical adaptation or the RCSI. So only one of which, okay, hindi siya pwedeng both. Kasi the visa that will be granted to you will be specific to the pathway, okay? So this clinical adaptation or aptitude test, the one that we discussed with Pete Aldwin the last time, yun yung pathway. Those are the two pathways that your employer must or might require you to have. So clinical adaptation is, well, they were saying it's easier compared to RCSI aptitude test, but we'll see the experience of Pete Aldwin of Nurse Cleveland about this. Okay, so yeah, that's the brief overview of clinical adaptation. So JC ang tawag ko dito eh.
Uh, yeah, that's my
Yeah,
nickname at home.
uh, correct.
But anyway,
So in your hospital, JC, you were required to have the adaptation, not the aptitude test. Yeah.
yes. So in my hospital, all nurses who they hired, international nurses, they are required to undergo adaptation. But recently, yeah, all adaptation.
All adaptation, because some hospital, like the teaching hospitals, usually they have the clinical adaptation, but sometimes they're requiring RCSI aptitude test. Really depends on demand of the ward or specific unit. So anyway, we already discussed the aptitude test previously. So in this clinical adaptation, JC, um, what are the requirements if there is? Para lang alam ng mga subscribers natin. Kung meron.
Yeah, actually, for the hospital will give you a like list of what you need to bring, like clothes, your accommodation. It will be in partnership with your agency as well. So it's the agency who's giving you the inputs, and then our hospital also send us e-learnings. So before we went to here in Ireland, we already done some e-learnings. It's like an orientation already. So I'm still working in the Philippines, and they're having us do the e-learnings already before we come here, so that we are already finished before we come here, and it's paid. So you just have to coordinate with your facilitator that since it's e-learning, or it should be done at workplace. So yeah, they will ask you to do it.
Mm,
Requirements: English, patience, confidence,
mm.
strong will, and
A
yeah,
lot of
that's
things.
it.
A
Yeah,
lot of things.
a lot of things, but you just
Yeah.
have to prepare yourself physically, emotionally, and mentally.
Yeah. So I just wanted to point out yung sinabi mong e-learning. So just to be specific, guys, this is what we call the HSC land courses. So these are the prerequisites, especially during the induction. I mean, they will ask you to complete this, but Cleveland is correct that sometimes the agencies are like giving you, the topics that you have to accomplish. Like for example, infection control, um, ANTT, the aseptic non-touch technique, something like that, and a lot more. Okay, there are several courses that you have to take before starting your clinical placement. So HSC lab, that's correct, and what do you call this? With regards to the uniform, Cleveland, were you advised to have your own uniform brought here from the Philippines?
Yeah. So for the training or adaptation uniform, I brought my school uniform, my work uniform. So I just removed the lining, the green lining. So it's
Okay.
only pure white. They don't
Yeah.
care about the design of the as long as it's white.
Yeah.
Then
Yeah.
you have they don't care if there's no pocket of or there is a pocket. Just make sure there's a pocket here and at the side, so it would be handy
Easier for you
and
as well.
yeah, easier. Yeah.
Uh,
And for the pants, I just use my black pants. I actually bought black pants or trousers
uh,
as they
I
use
think
it
it's
here because if pants they think it will be underwear. So anyway,
yeah.
trousers and then yeah, that's what
Uh,
I use during my adaptation period.
yeah.
And
I think
then
it's
once
yeah. Go ahead.
go
Sorry.
no no no
No, I was just wanted to add regarding the uniform because I think it's the same for all adaptation takers. Like they're requiring the white tunic. It's like your scrub suit, guys, without any piping, as you call it, walang different colors or anything. So that's the white tunic and black or navy blue pants. Sa hospital kasi namin, it's navy blue, so it looks like black already. At the far side. So black or navy blue
yes,
pants. And
black or navy
how
blue.
about the shoes, Cleveland?
The shoes is black shoes, so I tend to wear the the leather type or the non the one that doesn't absorb any liquids.
Yes, yes.
I use the one from Skechers.
Uh,
Skechers baka
Japan
naman.
one.
So actually anything that doesn't absorb liquids because you'll be working with
Yes,
patients and there will be stuff spilling on it.
yes.
So for it to be
Uh,
disinfect immediately, for it to be disinfected immediately.
and also,
So
guys, I just want to add with that. Ang sabi ng coordinator namin previously, you should not wear any rubber shoes or yung clogs, yung mga may ingay. Kasi yung rubber shoes, it tends to squeak. Usually, kapag nasa clinical
yeah,
placement ka,
that's right.
bawal yun, guys. Pero syempre, once you finish your adaptation, you can wear any shoes you want, to be honest with you. But with the clinical adaptation per se, bawal yan.
Yeah,
Dapat, yeah,
that's right. And you should wear a shoes that really works on you because you will be walking a
yes,
lot.
that's
You'll be
correct.
moving patient a lot
Yeah. And the Skechers is a good brand, to be honest. Kasi napaka ano niya, soft, no? Sa sole. It's really good.
through.
Uh,
At least it still lasts. I'm still using it. I just added a memory foam from it because of the frequent walking.
mm,
The sole inside will tend to due to wear and tear tend to lose its how they call it, its strength.
mm,
Or anyway, I just added a memory foam, for it to last longer.
yes,
Because
yes.
I'm not really a collector of shoes or sneakers or rubber shoes, so
Mm.
I just tend to
Okay,
change
hindi
it
ka
whenever it's
sneakerheads, ah.
needed. Yeah. Like you, I'm a hat fan, so I have
Oh,
just two
me too.
pair.
Look, I have
Yeah.
different colors of this, like same, same color. I mean, same brand.
So
Anyway, aside from that, so we talked about the HSC land courses that you have to accomplish before coming here. Uniform. Now, this is very important. They will ask you about this. Ticklers. You know what tickler is? Small
yeah,
notebooks.
small
It is,
notebooks.
yeah, it is very important that you have that. Kaya tama si JC. It is very important that your white tunic has some pockets. It will be easier, like for easy access. So you have to have that. Well, when we were in college, diba? Our clinical
Yeah,
instructors will ask us about ticklers. So you can jot notes, instruction ng mga clinical facilitators and all that. Mga kailangan yung pointers. You have to have that. Okay.
yeah. It's
Anything else?
just a reminder to keep you what you need to do, what needs to be done. Okay. Yeah, that's it.
Yeah.
Uh, Anyway, let's go through with your questions, and maybe at the
Yes.
end
Yes.
I'll do a full
Uh,
full review of
correct.
what happened to me. So
Uh,
whatever is in here is depends on the hospital that I'm working with
yeah. And
and
experience.
my experience. So just a disclaimer. So what's happening to me is not the same or hindi pareho dun sa iba
Okay.
na experience. Pero I'll share to you because I've talked to them, so I can share it to you based from what I heard sa mga sa mga sabi-sabi, but definitely there's truth into that. So,
Yes.
yeah.
And sorry, ngayon ko lang naalala. You know what, guys? You have to have your fob watch as well. You know,
Ayan, pop
na,
watch.
yes. I posted this in my FB page. You know, fob watch. Ito yung watch na nilalagay. You know, that you can pin to your white tunic. So yeah, you have to have that kasi as per infection control guidelines, wristwatch is not allowed. So you have to have that with you as well. So mga pointers yan to bring, okay? So I just have one quick question here from I read it earlier. Uh, Hi, Anne Francis. Hello. We will support
Ay.
you, Nurse Raymond. Very helpful po sa amin. Thank you so much. And thank you din kay Nurse Cleven. Yeah. About white tunic, may question dito eh. There you go. So, are they strict for the white tunic para po sa female? To be honest, hindi naman. Hindi naman. Alam mo nga dito yung mga white tunic nila, hapit kung hapit sa, sa mga babae. But I as always advise, kung ano yung comfortable sa inyo, yun ang suotin nyo.
Yeah.
Oo.
Working na
It,
comfortable clothes. Yung hindi yung pag inangat mo, kita na yung katawan mo. When you
correct.
raise your clothes, like you can see your skin. It's
Ah,
just, a working tunic for you, and it's comfortable as well as it's, appealing to, not really appealing, but pleasant to the eyes when they see
yes,
you. Hindi naman
yes.
yung sobrang luwang na para ka ng hanger,
Yes. At wag
look
din
like
naman
a
sobrang hapit na parang fashion show naman yung nangyayari, di ba? But I'm telling you guys, lalo na sa mga students dito, mga Irish students, hapit kung hapit yung mga tunic nila. As in yung korte ng katawan nila, nahuhubog. But if you're not comfortable with that, don't do it, okay? So I advise as well, since you will be coming from overseas or from the Philippines, have it like, tailored fit sa inyo. Like, go to Baklaran. Ako, nagpagawa na ako sa Baklaran eh, during my
they
time.
will show you naman the designs that,
Yes.
some
Uh,
examples, but then again, they're not really particular about that kasi you will only wear it for 6 to 12 weeks. After that, you will wear it for an extended time until your hospital clothes arrive.
ah,
And it
ah,
depends. Because in our hospital, if you are in the wards, in the units, you have to buy your own. But if you are in the special area, scrub suits are provided.
Oy, sa hospital ninyo?
Yeah. Well,
Ah,
for
you
the
mean the scrub
scrub
suits?
suits are
Okay, I
provided by the
gotcha.
hospital,
I
but
gotcha.
the uniform in the unit o yung
Hindi,
damit
you
sa
have to pay
unit sa
that.
ward, you have to buy your
Ah,
own.
Sige, discuss natin yung uniform after ng adaptation,
Yeah, yeah.
yung uniform na mismo natin. So, we'll discuss about that. Okay, so we already discussed about, the requirements and the things that you bring here, okay,
Also, I
before
have
the
one more.
clinical adaptation. Okay, go ahead.
Sorry. So ball pens. So yung ball pens
Yes.
nila dito is ito, ayan, malalaki. Ayan, if you're used to this kind of ball pen, so ito yung gamit nila. Meron silang push din push button, but malalaki yung ballpoint nila. If you're the one using fine point like 0.5 or 0.3, might bring as well those kind of pens. And then they just use black ball pen for writing. If
Yes.
if the hospital you're going to is still, you know,
Uh,
using the handwriting system, because other hospitals are already computerized. So
yes.
our IC is computerized, but our hospital is transitioning to computerized as well. But it's taking time. So like
Uh,
5 years is the plan.
yes, yes.
Yeah.
That's correct. And since you mentioned about pen, we have a question here from Maria Ravenna. So ano po ang color for documentation sa MMUH? Oy, thank you naman. My question. Magiging ka-work ko siguro to somewhere. I'm
Yeah.
working in MMUH. You know what? Hindi tulad sa Pilipinas na may different colors per shift, 'di ba? May black, uh, blue and then red, 'di ba? Kung three shifts. Pero dito guys, black lang. Black ang required for documentation. No other colors. Okay, even sa documentation sa drug chart or anything. Okay? So walang ibang color. Okay? So yan. So anything else to add? Kung anong kailangan dalhin, Cleven?
Um, your personal needs. Pero in the adaptation wise, it's just uniform, ball pen, pub watch, shoes, just to, you have something
Oh, I
from the
remember.
start. Yeah.
Yeah. I think you will benefit, guys, if you will bring, if you have yung mga BNF book o kaya yung NIMIS ba tawag na sa Pilipinas? Yung
Yeah, name is
drug handbook kasi
Dragon Book.
may drug study din kayo. But anyway, if you don't have that, we have our library in our hospital naman, and you
Yeah,
can
and
access that
ac-
online.
there's also one in the ward, and usually they just use the online, just
Yeah.
go online and it will show there. So it will actually Google will show you the one that's being used on the
Yes.
European area.
Correct.
So Google really helps because it will not show you depending on the setting. So you have to update your setting in Google, or else that's one thing that I've like right at the bat experience when I came in Ireland. It's asking me to change where I am, so it will show me what is right away is available in my area. So when you do search, it will not be from the Philippines, but it will be in the European area.
Yes.
And
Ah,
BNF is available in the wards in the unit. Actually, no one is using it. That's the odd thing. But I tried to use it. It's really helpful.
yeah, and that's it's for you also,
Yeah, it's for yeah.
because there are a lot of medications here that we are not familiar to, you know, like it's new, like medications that are not being used in the Philippines or in Saudi Arabia that you can only find here or can only like they're giving here, that we're not familiar to. So anyway, it's very handy if you have it, but if not, may Google naman. And of
True.
course, may NIMIS tayo na tinatawag or yung BNF.
May free
Yung
Wi-Fi
BNF ang
sa
inano
hospital.
nila. Correct. So yun. Yeah, this question, how long usually ang adaptation? Same po ba lahat ng hospital?
No, no, it's not the same. So, for us, it's a minimum of 6 weeks. If you think that, if they think that you are good enough, because they will, every 2 weeks, every week you have what do you call this?
Assessment.
A reflection,
Mm.
assessment. Then every 2 weeks, you will have a meeting. So that's the initial for the first six weeks. You have initial meeting, you have intermediate, and your final meeting. The final meeting will be your 6 week, fifth 6 week. Depending on that meeting, you will already know if you will be extended or not. So the extension it would be like every 2 weeks.
Mm-hmm.
So until you reach the 12 week. 12 week is the maximum. So that will be the final decision if you can still go on or not.
Mm-hmm.
So usually mostly high percentage will pass, but there are some others are 100%. It depends really on the batch. So there are some who fails on the adaptation.
Mm, mm. Yeah, that's correct. And just to clarify that, Cleveland, itong 6 to 12 weeks, it's the same for all the hospital because like this is mandated by the NMBI. So adaptation is from 6 weeks up to 12 weeks, which is the maximum. Now, Cleveland is just saying that it really depends on the clinical placement coordinator on when to deem you competent. Because in our hospital, I know that 6 weeks is the minimum, but our placement coordinators aiming always at 8 weeks. So we're like with the on clinical placement for 8 weeks
That's
before
right. Mhm.
before the final final judgment, kumbaga, final assessment. So other hospital like Beaumont Hospital, I remember talking to one of our friends. 6 weeks. That's it. 6 weeks. You have to pass it. Like if not, you will be extended for another 2 weeks. But six
Yeah,
weeks the minimum, and they will have the final assessment on that 6 weeks. So on our hospital,
yeah.
unfortunately, it's like 8 weeks. So
That's
hindi
the
naman ano yan.
Yeah, you're right, Nurse Raymond. That's right. Kasi that's the goal. Because they want nurses to be, coming like working as an RGN right away. So that's why they aim the goal is like within 6 weeks you need to pass. And
Uh,
then but there are some hospitals like you like 8 weeks is our time frame because it would give ample of time for the adaptation nurses to adjust. So I also have one friend, her it's Kat from the Matter Private, who um works in the operating room. So for them, it's 9 weeks.
9 weeks. Oh,
Yeah,
that it
nine
really
weeks.
depends. Depends on the
The
hospital.
area, the
But
hospital.
yeah,
Yeah,
but it has to be 6 to 12 weeks. That's the range of clinical adaptation. Now, isisingit ko lang tong question ni Maria Ravenna. No, iWatch is not allowed in the duty unless you are a nurse already. Because some of the nurses are wearing iWatch or different fancy watch that they have. But iWatch is not allowed during clinical placement. Please, please, nako, kung ayaw nyo mabolcha kayo
Yeah.
dyan.
And um, it depends also how strict the hospital policy is being implemented in
Yes.
your areas.
But
So
most but mostly infection control, like they're advising not to use any watch.
yeah, because
Only wedding band lang actually.
yeah, so for us it's not allowed. So we don't have anything on our wrist during our shift. So after that you can wear it anywhere.
Yeah.
But
And you
if
know
you
what?
are
Hmm. Go ahead.
so if you are in the area, it's only the fob watch, nothing, below the
Ah,
arm.
ah.
Because it will be, if you are handling directly with the patient, it would really cause parang headlang siya, or it will cause nuisance when you're handling patient, because you will do a lot of lifting, moving patients.
Yes, yes.
Oh,
Yeah.
I forgot to give my background. So I'm working in a acute medical unit and medical short stay. So I have two areas. So acute medical unit is a step down from ED. So it's like an ED as well, but not that urgent cases. And medical short stay unit, which is like a ward, but patients are usually independent and stay for less than 5 days, supposedly. But we have patients like um, a month already, or maximum of 3 months. But they're not really acutely ill. So that's my area.
Hmm.
So you would know where I'm coming from.
Okay. So yan, ito, i-answer lang natin si Terence Rosales. Hello po, Nurse Raymond, Nurse Cleven. Ask ko lang po if yung black pants is black scrub suit or pants po na pang college students. Thanks po. You know what? Hindi siya scrub suit actually. It's like, how to explain it?
It's like you can use a like how do they say it, parang utility pants, something like that, but not too thick. So it's just or the regular trousers, like the one that you use in formal wear, we can use that, or
Exactly.
um
Yung slacks. Yeah, parang
slacks.
slacks siya.
Yes,
Parang
slacks.
slacks.
Slacks is the terms natin sa
Slacks
Pinas.
material, parang ganun
Mm-mm.
siya. Pero you know what I used? Yung parang scrub suit nga actually. Pero yung hindi siya yung scrub suit na parang madaling makris. You know what I mean? Like yung
Yeah, yeah.
scrub suit na parang plastic ang dating eh. Basta, I don't know how to explain it. But you know what? Slacks is the right term for that. So yung
It's
slacks
slacks.
material can be used, okay? Nako,
Uh,
nagja-jump tayo eh. No? Kasi
okay,
so
okay,
much
okay,
na
okay,
to.
yeah. Let's go on where we are. Yeah,
No,
let's go.
guys, sige lang, mag-message na, mag-comment lang kayo dyan, and then we will try to hit the bird when we see it, okay? So, ito muna, placement, okay? Of
Mhm,
course, this is clinical adaptation. You mentioned that you were working in acute medical and emergency, di ba?
mhm.
Yung placement, based on your experience, were you allocated right away to your unit or to different wards first?
So in our hospital, so we were given, it's on the contract where we'll be placed,
Mm-hmm.
but initially we are all on the units. So during the induction period, I think on the third or fourth day, they gave us a list where will we be assigned
Mm.
in our adaptation, but they changed it recently, like 6 months ago. So wherever you are, contract is, whatever is on your contract, example, you will be assigned in the operating room or ITU, or usually it's operating room and ITU or ICU. So
Mm.
now they will do their adaptations there, so they will not go into the wards.
Yeah, I
But prior
actually,
to that,
mm,
it's everyone goes to the ward, to the units, and do their placements
exactly.
there.
Yeah. I'm actually like surprised because when we had a meeting here, meeting talaga, yung meet and greet natin dito sa bahay, one of our friends there mentioned about, she's working in ICU and her clinical adaptation was in ICU as well. And I find it very surprising kasi it is actually under the mandate of NMBI that you have to be exposed first to the ward level before going straight to your clinical area. So um, expect, I don't know, it really depends on the hospital, but expect that you will be allocated to the ward far from your assigned or your allocated unit kapag natapos yung adaptation nyo. For example, in my case, I was working in high dependency previously, and I was exposed to scheduled care ward. So it's like a day surgery, and also in HDU. So like half of it was in HDU, and then half of it was on um, day surgery. So just bear in mind, guys, na itong clinical adaptation, as per the NMBA mandate, you have to be exposed to the ward related to your unit, but not exactly or not directly to your unit, if that makes sense. So, ganun siya. But, sabi nga ni Nurse Cleven, nowadays, like they're sending you right away to your clinical area, depending on your contracts. But as I mentioned, just be prepared na mapunta kayo sa ward. Especially if you are working in a critical area like ICU and high dependency. Working in the ward can be like a pain in your something. Because if you're not used to dealing with a lot of patients, not dealing with a lot of paperwork, well, it's a different story. So just bear that in mind. Okay, tama ba yung
That's
sinabi
right.
ko?
Yeah. Yeah,
uh,
yeah, that's right. That's right. The downside is because it's not the ways and means and the delivery of care is really different from the areas that we're coming from. So um it will be a challenge for people who did their adaptation in the
mm,
ICU as well as in the operating room, especially in the operating room,
mm,
because uh, if they are pulled out from the wards, they
yes,
know they
that's
don't know
I
what
think
to what will they expect. That's why I think it's better to have an adaptation on
exactly,
the word before you
exactly.
go to the OR or ICU, because if you will not be able to adapt in the OR or ICU, at least you have a fallback because you already
Mm,
passed the adaptation in a ward which they think that you are capable of.
exactly. And that's very true actually, like being familiar, especially with the paperworks, because not all
Yeah,
paperworks are being used in specific areas. Like for example, I'm working ICU at the moment. I don't know all the forms. That's why if I'm receiving a patient from A&E, we're not using those forms. So it's really nice to be familiar with those forms, like ano ba yun? INO form, um, a lot of forms.
I
A lot
news
of forms.
it really depends, but in general there's they follow a certain set of forms, general, but and then the forms will be individualized depending on the institutions or the hospital, but they
Yes.
have a backbone for that. They have the nursing interview booklet for us, so it has the history of the patient, the scoring that they use. For us it's not the Waterloo score for
Yes,
the
hindi siya
it's out
Waterloo.
it's Mailor. Are you using Mailor?
No, 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 we're not.
So we're
Uh,
using Mailor for the pressure ulcer. So it
mm,
depends on the hospital really,
uh,
but it's just on one booklet.
uh, parang breed and score yun, di ba? Breed and score sa Saudi
Braden
Arabia.
score is also for the
Yes.
pressure ulcer,
Uh,
but
uh,
yeah, so
we have different, ano man tawag dyan?
what do you mean?
It's at the tip of my tongue. Yung mga yan, yung mga more small risk, mga breed
Nursing
and
care
score.
plan or nursing assessment care bundle.
Bundles, yeah. Yung mga bundles, yeah. You got me there. Very good. So yun guys ha. And it really depends on the hospital as well. Yung duration nyo per department. For example, it can be 2 weeks each, if 2 weeks or 3 weeks per unit. For example, in my experience, it's 2 weeks and then 2 weeks. Or 3 weeks and then 3 weeks. Kasi 6 weeks nga naman. So tama, 3 weeks and 3 weeks. So it really depends. Kung 8 weeks naman sila, lamang 4 weeks and 4 weeks yan. Uy, ang dami
Yeah.
ng question, hindi ko nakita 'yon. Ang dami nilang question. Ito muna, isa-isa muna natin. If you get sick during the adaptation, may extend po ba yung adaptation mo? Definitely. Definitely. But you will, of course, be filed with sick leave and that's paid as well.
Yeah,
Most,
it's paid.
uh,
So it depends on how many sick leaves you will do. But
yes.
then again, if it's only 1 or 2 days and they think that you are adapting well, it will be
It will be okay.
it will be okay. I mean, they might have you finish 6 weeks, but for me, like if you are like nagmamadali kang kunin yung sahod, i-achieve yung sahod mo kasi ang sahod mo is adaptation rate or same with the students when you start.
Yes.
Pero kung di
And
ka
that
naman
is,
nagmamadali,
yeah, and that is around 20, how much?
26,000 annual
Per
annual.
euro, it's around roughly about 12 to 13 euros an hour yung student rate natin.
Ah, 13 euros, 13 to
Oh, parang
14
gano'n,
actually.
12 to 13 na ngayon na or yeah, before.
Yeah. per
So
hour.
yun. So ganun siya. Anyway, guys, yung student rate will only last during the adaptation. So after you finish and you have your pin, it will jump up to what? To your, signed
To
contract.
your, yeah, to your point scale. That's what's good about here. Unlike in United Kingdom, I'm not, you know, dissing them or anything.
Basher.
Yeah,
Basher ka. Hindi, joke lang.
bashing them, but it's really worth it here because they credit your experience. It's really, well, I heard you said earlier someone's, gave out to you about the about the living expenses here in Ireland. I'm hearing a lot as well in my working that, house is expensive, because that's because of the inflation rate. But later on,
Yeah.
your salary will go up and have it equaled with the
Yeah.
with the
Yeah.
inflation rate. But
Exactly.
yeah, anyway, we're going
Mm.
beyond. So it really depends on us how we go, because it's the same everywhere.
Mm. Mm. Very good. So ito kay Glee Ligaya. During adaptation here, hehe pala yun. Free na po bang, and free na po ba tayo or to avail free checkup and medicine from our hospital? Your thoughts?
Okay. So initially, you have to have a GP. Okay, let's go to the how it really goes. So if it's just a regular checkup, you have to have a GP. You have to pay as a private because it depends upon your salary. Because if you want a free service, you have to apply to HSE, apply a medical card, and then apply a drug payment scheme card, so
Mm.
that you will get support from the HSE. But initially, as much as possible during your adaptation, you should be at your tip-top shape. But if it's an emergency, you can go to your, parang Pinas style, makikisuyo, makikiusap, may mga ibang Pilipino naman.
Mm.
And example for me, it was, if it's work related as well, you can go to
Mm.
A&E, so to have you assessed. So for me, like, I had COVID, so I did swab in my hospital, and it's for free. I did not pay for anything. And actually go online. HSE provides you with a
Swab,
free lateral
antigen.
swab, yeah, nasal
Mm.
swab, antigen test. And I also have encountered, like, manual handling incident. So I have to go to EP. So it is a long line. Since you're staff and you're working, you can ask a staff nurse to, inside. Anyway, iyon. So, parang Pinay style. So, na-x-ray ako agad. Nakita ako ng nurse specialist sa ortho. Hindi doktor, nurse specialist sa ortho.
Mm.
And then, wala namang bale or wala namang dislocation, fracture, buti na lang. So, yun na,
Mm.
pinabalik na ako sa work. And then, yun nga,
Okay.
na-surprise sila, ba't ako pinabalik? Yan. Sabi ko, okay lang. Pero, if you're gonna go on sick leave, they're okay with it. I
Yes.
mean,
Yes.
it's you. Especially if you cannot perform at work already.
Mm. Mm.
Ako lang
Yeah.
talaga, medyo at maano ang attrition ko sa pain, and kaya
Correct.
naman ng pain reliever.
I think I don't know if Glee Ligaya is working in Saudi Arabia or in the Middle East kasi doon may staff health eh. You can
Mhm.
just go there directly and then have your free medication, whatever prescribed. Pero dito guys, I hate to break you with the news that the medications are not free here unless you are under, the medical if you have the medical card and you have a discount using the drug
Payment
what do you call
scheme,
that?
yeah. Drug
Payment
payment
scheme.
scheme
Yung
card,
ganyan.
yeah.
Yung check-up is not free, especially if you go to your GP. Kasi sa GP, tama naman si Cleveland doon, they are our front line. Yung GP yung mga general practitioner. That's why they're called GP. So sila yung front line. And then if they need to refer you to the hospital, that will be free of charge. You just need to go to the hospital directly because you paid them already. But for acute, like, things like nahimatay ka or anything,
Chest pain.
definitely straight to the A&E. Now, if for example, if you have any concern about your health, meron tayong tinatawag na occupational health. All hospital, all hospitals have this occupational health, so they will assist you about the management and all that, especially sa mga follow
Work
up.
related
For
issues.
example, if you're pregnant or if you have some infection or anything, they will help you with this. Okay, pero it's not totally free if you get my point.
Yeah, yeah.
So, yeah. Anyway, guys, maya na yung mga tanong niyo about. about out of topic natin. No, I'm just kidding. No, we'll just continue, okay? So itong
Mm.
placement natin, so this is like two, sa inyo ba, Cleveland, two placements kayo? Two wards?
We only have
Or
one
isa lang?
placement. For
Oh,
me, it's just one placement. Kung ward ka, kung anong unit ka, doon
doon
ka
ka na.
na. Pero
Oh,
yung
good.
dun sa mga, for those who will, OR, ICU, so they will just pass the adaptation and then they will go to their respective areas na. It's not another adaptation, but it's their orientation on their special area. Because
Mm,
the thing here, the educational system here is everyone goes RGN. And then depending on your specialization, you will take another course if you want to go psych, if you want to go children, you will have another course. Now, once you are an RGN, you want to go to operating room, you want to go to the ITU, you will add another course to your RGN. So that's how it goes here. So basically, it will be provided by the hospital already. So I have a workmate who is Irish. So she is working as an RGN and applied as an ICU nurse. So that's how they progress. Not
mm,
unlike in the Philippines, you can work in ICU right away. But I think everyone
yeah.
anyway, so here you have
Oh,
to undergo training.
yeah.
So
And you know what, Cleveland, it also depends on the hospital. You remember
yeah.
we have one friend here, she worked directly to ICU. So it really depends on the hospital. In my case, because I initially applied for high dependency, I had to take ICU course, and that's 6 months. That's free. Okay, that's like with CME something. You know, the continuous. Ano nga
Medical
ba yung CME?
education.
I don't know. I forgot. Anyway, it's like continuous education parang sa
Mhm.
atin, gano'n. So anyway, that's 6 months, okay? So that's paid as well. So it really depends because they can, hire you directly to special areas. But I received one question. Sir, pwede po ba yung ano, or yung mga dialysis nurses po ba are advanced nurse practitioners? They are not. Kasi lahat, even dialysis nurse guys, walang ano dito, walang special certification. Just like in the Philippines, di ba? Kailangan certified renal nurse ka bago ka makapag-work sa dialysis. Dito guys, if you were just interested to work in the dialysis unit, you just need to tell to your manager, and then you can apply to the unit. So they will train you there, but there's no specific. Ngayon, it's not
That's
an
right.
advanced nurse practitioner because advanced nurse practitioner is like at the top level already. Dito guys, ang transition kasi like RGN, you're correct about that. And then afterwards, if you want to do post grad on different specialities, you can do that as well. So in post grad, iba pa yun sa masters. In post grad kasi is just 1 year, and then masters that's 2 years. So if you are like to master about psychiatric nursing, intensive care unit, or A&E, that's another. So dito sa hospital namin, it's post grad is like covered by the hospital, and then the masters it's not. So it's quite expensive to be honest, yung masters, kasi it's like 3,000 euros a year. So that's 2 years
If
almost.
you're an Irish
Yeah. So ganun siya.
or EU, yeah.
Well,
Um,
anyway.
what else will I add to that? Yeah, so the thing is, kapag inassign ka nila dun sa special area, is, ayun nga, because yun yung in-apply mong area actually. So you have the experience for that. So there's no problem with that. They will just orient you. You will undergo a course just to, adapt you, assimilate you on how they do things in that area.
Mm, mm. Yeah,
Yeah.
that's correct. So since sinabi na nating adapt to the certain area. So ngayon, let me ask you about your experience, okay? Sa clinical placement mo. So
So
you completed your placement in 6 weeks.
yeah, I completed
Yeah.
my placement in 6 weeks.
So how's your experience?
So it's actually first I was it really depends on how you are as a person. So for me, I was assigned to a Filipino preceptor. It might be different if I be assigned to an international preceptor like an Irish or an African or different race. Sorry. Anyway, so it was a Filipino, so I was very very lucky. The thing is that I'm really too I'm thinking ahead of what is the with plan for her. So there was a little bit of misunderstanding at the start, but we work it out at the end. So it's really important that you build rapport at the start with your preceptor. But it's in my area, it's really fast going. There was not enough time for us to talk. So if you haven't like set goals and objectives yet with your preceptor on your area, observe first and just do what they ask you to do. Usually, they will ask you just to do observations, which is vital signs taking, assist the patient doing with the ADLs, like putting them on chair, fixing them on the bed, change linen, bed, change pads, um, assist them in walking. Basically, that's it for the first few days. And then once you have your goals and objective, your preceptor, gradually they will add more responsibilities to you. So that's how it goes on the area that I'm in. But let's talk about in general. So when I came here, we did the adaptation first. They provide us the HSC land training or the e-learnings. So as much as possible, finish all of it before the start of your adaptation, because it would be difficult for you to concentrate, and you have an idea already how it works, because it serves as like an orientation as you as well. So they have the iNews, they have their like the policies that is pertaining to the hospital that you're working in. So you do a week of adaptation, you will work with your facilitator, communicate with them. So in our group, we only six, we are all Filipinos. That's good about it. And then because for me, my personality is like I have to know what's happening because I don't know. I'm on a foreign country, so I need to adjust. So I was like became the leader of our group. So I was the one communicating with the facilitator, which is I encourage everyone to you know, be communicative or communicate
Assertive,
with the
yeah.
people that you're talking to, because that will be your tool in passing the adaptation. Because if you'll not talk, you'll not communicate, that will be a problem. Because
Mm, mm.
anyway,
Actually,
we have,
communication is one of the things that can fail you as well if you do not do it like perfectly.
yeah,
You know,
and also attitude.
Attitude, exactly. You know what? Tama yung sinabi mo. Let me just discuss about attitude. Kasi especially to those nurses who like worked for years outside Ireland, overseas or in the Philippines, sometimes it's really difficult for them to go, to take a step back and then be not a student but a pre-registered nurse here in Ireland. It's very challenging on them, and sometimes they're the one who are being extended because they think like I'm 10 years ICU nurse, I'm 10 years ward nurse, I was a head nurse before. Yun yung mga challenges ng mga medyo matagal na sa industriya, kumbaga. So you have to like go back to the basic, and then because this is a new country and European standards of uh, nursing care or practice, it's like very different to the American, because tayo we were like trained using the American standards,
Yeah,
but
that's
here
right. That's what I'm talking about. Yeah,
it's kind of different here. Lahat dito, lahat patient safety, patient care, patient welfare, lahat patient. Yeah, but we're not saying that we don't have the autonomy, because we really do have. Like you will experience the full autonomy of being a nurse pag dumating na kayo dito sa Ireland. Okay? So, Cleveland, I just want to ask you, since you did the 6 weeks, ano yung mga booklets na kinomplete mo? I'm pretty sure you have that.
yeah. So aside from the hospital booklet that they will provide you, so there will be like um time like well, the main booklet that I'll just emphasize is the main booklet that you need to read before you go here if you're going adaptation, and what we use as well, because this is the one that will be sent, that will be kept by the hospital, but they will only send one form to NMBI, which
Mm,
will be signed by the director of nursing. It's the compensation measure required booklet. So I'll post the
mm,
link here from the NMBI
mm. It's like
on
the
the page.
assessment book. Ang tawag namin siya assessment booklet actually.
I'll just post it on the Facebook group, the chat, so they will be able to see. So
Yeah,
you have
check
to
it out,
read
guys.
that. So I will just emphasize what it says here, or what is expected to to you as an adaptation nurse in general. So it says here that hold on, where is the highlight? So the candidate nurse must achieve competence. So competence is demonstrated by the ability of the candidate nurse to practice safely and effectively. And of course, fulfilling the professional responsibility of the scope of practice, which is the six domains of
Mm,
nursing practice, scope
mm,
of practice.
mm.
So that's your guiding booklet. So here you will see you will undergo three meetings: initial, intermediate, and final. There will be like in our hospital, we also do the reflective
Yes, that's daily.
the,
Sa amin daily.
sa amin weekly every Thursday
Ah,
yon. So parang reflective how do you call that? Oh my god, it's the tip of the tongue my again. So parang reflection. Yeah, reflection every Thursday once a week.
mm.
So what else? So drug study.
Yes, drug study, correct.
It's part of your requirement. So we gave like 25, I think, and
Mm.
then also
Yeah.
some research. So here they like evidence based. So it's not like just a hearsay. When you say to the patient like this, patient is like that. If it's not written, they will not, believe you. Especially the observations, or you have to write everything in the INUs. That's where your nursing critical thinking skills will come in. So patient presented with a low, high INUs or high news. So should I refer this patient right away? It depends on the signs and symptoms, because sometimes patients scoring high news, but you don't really have to refer because of this condition. So something
Naka-oxygen
like
lang
that.
pala, no?
Yeah, so sometimes you just need to,
Ah,
you just have to replace the patient, or rather reposition the patient, and then you just recheck out after 15 minutes. So that's where responsibility comes. Like whatever you do to the patients, it's like just not taking the observations and just refer them to the doctors. You have to do something and recheck the observations. And you think that this is something that needs to be reviewed by the doctor, you have to do all the assessments like observations, so that when you present to the doctor, you have the proof or evidence base that this is happening to the patient, because doctor rounds usually once a day or
yeah.
twice a day if they're newly admitted.
Hmm. And of course, may tinatawag mo tayong mga nursing intervention. So you have to do that as well before going to the doctor, because sometimes you can sort it out yourself. And of course, you need to inform the doctor as well regarding that. So that's the experience of Nurse Cleven.
Ayan.
So
Sorry, additional for sorry, I'm moving back because there's
yeah,
so
yeah, go ahead.
much the trail. So aside from the medication, the research, also your time hours, so it must be signed. Comments from your preceptor. So every day, the preceptor that you're working with, you at before the end of shift, usually later in the afternoon, because you're not doing nights for the rest of your adaptation. It's always a long day. So ask them for a comment for today, what happened to you. So they will write on a piece of paper, because that's your proof of what you have done today. And also, they will ask you to do a personal diary of what you have learned or what you have done for the day. So it's like a diary of yourself during your adaptation period. And once you're finished, and then they're happy to sign you off, it's not actually the decision of your preceptor, it's the decision of the unit where you are working with. Because you will not be working with just one person, but you'll be working with the managers, with other nurses, and with the HSCPs and doctors. So HCSP, so healthcare support practitioners. So
Practitioner,
those are your social worker, your occupational
physician,
therapies, your
pharmacist.
physiotherapies, your dietitian and nutrition. So, and also there's the bleep. So you have to learn how to bleep, like referring to interns. So communication is really the key.
Hmm. Correct. So yeah, alam mo maganda yung mga shinare mo about your experience. So mind you guys, Cleven and I are working in different hospitals.
Hospitals.
So his experience is actually fairly similar to my experience. So ito, may tanong tayo kay Angela Oreo. Yeah, Nurse Cleven, Nurse Raymond, ask ko lang po about MMUH. Sa September 12 po siya mag-start ng adaptation. Wow, congratulations. So fortunately, I'm working in this hospital. Okay?
Yeah,
And
fortunately,
fortunately, I'm working in this hospital. Let me share with you very quickly about my experience, okay? So itong clinical adaptation namin, so 6 to 12 weeks, and the goal is to finish the adaptation at 8 weeks. So yan yung goal ng aming clinical placement coordinator at that time. So 1 week of induction and then afterwards clinical placement. So I was working, or I was assigned to high dependency at that time. So I was my adaptation went to scheduled care ward and then HDU. So different to Cleven because he only went to one unit. So me, I went to two units. Okay, so you have to be very familiar with the iNews scoring and all that and all the paperworks. And you know what, guys? I suggest that you visit Gail DC's channel because she discussed about this, with Golda and other guests about, the paperworks, about the things that you should know for RCSI in particular. But you know what? That's very helpful as well to your adaptation, to your clinical adaptation. So please watch those videos of Gail DC. Okay. So yeah, so 2 weeks or no, 3 weeks of clinical placement in the ward and then in the unit. That's my experience. And then same thing, we have the competency book, which is from the NMBI, and then we have the assessment book, which includes in assessment book, guys. There you will find your daily. In our experience, is daily reflection. Okay, whenever you are on duty, and then you have the drug study, and then the drug study,
I
roughly
think
about
the
25
sorry,
to 30.
I think the daily reflection will be the diary because
Yeah, I think that's
the
yours. That's your
then we have a
in
different
hospital.
reflection every Thursday that we share to the
Yes.
other groups.
Yeah, I will discuss that in my experience as well. So yun, so drugs. So roughly about, because there are different kinds of drugs, the classes and all that. So we were given like five drugs, okay, per class. So you have to do the drug study, with the indication, the name, generic name, something like that, side effects and all that. And then the daily reflection, you have to complete that as well. That's for your own welfare as well, and your, to keep your mind sane during the adaptation.
Give
Okay.
out from
Yeah.
from the diary.
And then on your competency handbook, okay, you will see there, the initial assessment, the middle assessment, and then the final assessment. So yung you have a timetable. You will be given a timetable where when you need to finish your initial assessment, then middle, and then final. You have the timetable for that. And to be honest with you guys, if you are big Dutch on your adaptation, you have to keep that in mind. That you have to inform your facilitator about this initial, middle, and then final assessment, because sometimes, because of a lot of new nurses, they tend to forget about
Be
that. So you have,
proactive, yeah.
yeah, to be proactive, be assertive. And also, since Cleveland mentioned about the domains, okay, so that's correct, you have the domains there. Now we have a reflection per domain. Ganun din ba sa inyo?
No, it will depend
Mm.
on you. You have to pick
uh
which you think applies.
So sa amin, there is like domain 1, domain 2, domain 3, hanggang 6 yan eh. So different domains, guys, i-search nyo na lang kasi nakalimutan ko na rin. Natatandaan ko ng professional conduct, something like that. But there are 6. So you have to do your reflection about that. And may model pa nga din eh. May
Yeah,
model
memorial,
pa din.
tyranny,
I forgot eh.
there's a lot. So it's up to you what kind of model you
Yes, that you
think
will
would be
use.
applicable to you.
Uh,
I think
and you have to,
you, yeah.
yeah, and you have to correlate your reflection depending on your clinical placement as well. For
Yeah,
example,
so
on that certain domain, your experience, kung ano ba yun, what it is, what you have done, and what you will, recommend, something
yeah.
like that. Mm.
So the reflection focus on what you think you need to improve.
Yes.
So that's the focus of the reflection.
Uh, and during
But don't
clinical,
that
yeah.
there's a tip. Don't write anything that's very uh would self incriminate you. So just
Oo
light
naman.
ones, just light ones.
Mm.
Like
Kasi it will
having
turn out,
having trouble in time management because you're still adjusting on how it's being how it's done from where have you been, or
mm,
communication, just light things.
make it
Don't
subtle,
say
mga
things that
ganun.
will, yeah, don't wag kayo yung against you yung sasabihin nyo dun sa ano.
Yes.
So yeah.
Uh, and also, maybe some of you are not familiar about, we are talking about long day. when we say long day here, it depends on the hospital what time they start. But
Dalawa lang
usually
yung shift nila dito.
it's usually sa amin kasi half 7 to 8, or sometimes
Same.
there are some hospitals 7 to half 7, something like that. But that's long day, so we have 12-hour shift every time. Yeah.
So,
Wala
ayun,
tayong
12.5 ay ano, 12.5 sa umaga and then sa gabi 11.5.
11.5.
Yun yung
Yeah,
hours. And then
correct.
unpaid break.
Oo. Pero yung break naman, sagana naman yun. And it's like
Oo.
you were obliged to take a break. So
Yeah.
usually, basically, yun yung overview ng clinical adaptation or clinical placement. So after the target goal, like 6 to 12 weeks, kapag hindi ka ma-deem competent or you need may term sila din eh, I forgot the term. Uh, uh, Basta, if you are not
I think not
competent
competent
enough,
or
may
competent
term
ano
sila
not.
din eh. A worksheet. No, no, it's not a worksheet. Um. Anyway, I
Ah,
will ano dyan.
improvements. I think I know that like because we're doing preceptorship as well, so we signed the
Mm,
um students form like
yeah,
further. I think further learning. I think,
there's
but
specific term
it's
for that. It's at the tip of my tongue. Anyway,
anyway. You'll remember
maalala ko
it
yan mamaya.
later.
So
Remember
yun,
it later.
after that, after the final assessment, and if you were deemed competent, then they will tick that, and then they will sign that, and then send to the DON, and then the DON will give you the blue form. Blue form ba inyo? Blue form, di ba?
Green.
Green form
It's
ba? Or
green.
maybe it's
Yeah.
green. Oh yeah, maybe
Mm.
it's green.
It's a form
And
like
then
you are you pass the
yes,
adaptation.
and that will be sent to NMBI, and then they
NBI
will
and
give you the pin afterwards.
not yet. That's it.
Not
So
yet. Ah,
there's
yeah,
no
because
process
registration. Yeah, correct.
because
Yeah,
there's a new process now, unlike before.
yeah,
So
yeah.
with the new
Nasa paper-based nga pala ako.
Maya
I
ka,
thought.
I'm computer based, right? So
Uh,
everything is sent. So there's two process now with NMBI. So there is the recognition process. So recognition means recognize your like capabilities, your education. That's it. So and then it depends on that if they think that you can register right away as a nurse or you need compensation measure or you're not qualified at all. So usually for international nurses, it's compensation measure required. And you have two options, but it will depend on your employer. So if it's you have to take the written and a return demo or you have to go adaptation. After that, once you pass it, if you fail it, again there are clauses on that. You just have to read the NMBI. But for the adaptation, it's one take only, and you have 12 weeks for you to pass that. For the you can do an appeal, and MBA will review that, but then your problem is if you know staying here in Ireland because you are on a typical visa good for 6 months. Now for the RCSI, just two takes. After that, if you don't pass on the second take, that's it. You have to go under the process of application again. Now, once you pass, you already pass the recognition. They will send you an email that you are already recognized on the NMBI web page or our logins. It will say pass, and then they will send you a link. Oh, sorry. So once you pass, they will send you a link on your email to click that, and then it will say there's instructions there. And then once you click that link, your recognition is finished. Now you have to log in again on your NMBI to process the registration. It's not like automatic registration. So on the registration process, you have to follow the link. So that's where your English test will come in. So they will ask you about that. Basically, that's it, the English test, and then they will review you, and then they will email you. For them, they asked me about my certificate of good standing in the Philippines.
mm. I think they're
So
always asking about that because
always asking about that.
I've
Yeah,
heard about that. You know.
yeah. So they're always asking about that. So but it's I think it's their process flow. They don't ask
Mm.
it right at the bat. I think that's delaying tactics. So anyway, so they do that, and then it's actually up to you. Within the span of 3 days, you can get your pin if you able to fulfill all the requirements. We have JM. So he had an experience on that regarding the certificate of good
Good
standing.
standing.
So
Oh.
his certificate of good standing from abroad was expired already. So they only accept 6 months validity from the time of your application. But for mine, they didn't ask for it. Maybe
To be
it's
honest, they're not supposed to ask for that. To be honest, because in the beginning,
yeah.
like
They
you
already
have
assessed
your,
it. Yeah,
yeah, you have your qualification recognition, and they gave you the decision letter. Like
yeah.
they're
That
not
must be.
supposed to ask that, but unfortunately, they're asking about it. But anyway,
But it must be contested as well with them. Why do you ask it? You already assess it for the recognition process. It's part of it. Anyway, so then after that, you'll get your PIN. Yeah, you can just call them if they haven't messaged you back providing your PIN. Your PIN is just it's a certificate. So
yeah,
you can call them and
it's not
then
the pin, like a
it's not
pin.
a pin like it's just your number. So
Yeah.
with the adaptation, you will have a temporary uh, PIN or PIN number. PIN is personal identification number. So that will be your PIN once you are registered already. So at the start, make sure that before you start your adaptation, depending on what you declare on NMBI when is the start date of your adaptation, your temporary registration will be activated on the day, on your first day. So
Mm.
your clinical facilitator will ask you to log into NMBI and click the register button. Actually, I'm looking on my NMBI. My name is not coming out at the moment. Just check it now. So I need to check that. And it will show there your registration number, candidate number, your name, and your current status. It will says their adaptation nurse. So
Mm.
you must have that before you start, meaning you are registered with NMBI. Because there are some adoptees that came, but their name is not popping or showing in
Yes.
NMBI. That needs to be sorted out.
Uh, and by the way, let me just add regarding the placement, and because I heard you talking about the, oh no, maybe earlier, about the drug administration. Okay, so since you were an adaptation nurse in our hospital, specifically, you were not allowed to administer any IV medication during the placement. However,
Mm,
by guidance, you can give some oral medication.
yes,
The oral
that's right.
medication. So please bear that in mind. And here also in Ireland, you were not permit because we have our IV therapy in the Philippines, right? But once you were registered here, the same thing. You were not allowed to insert cannula or do venipuncture unless you have the training. So we have a lot of trainings here, to be honest, like manual handling, infection control training, what else? Um, yun nga, yung
You must
medication
have a certificate,
administration, yeah.
yeah, to show that you are not really competent, but you have undergone the training and you're
Yes, the
completing
training, yes.
the training itself. And then once you
Uh,
completed the number of required, like completion, like
Yes, may completion din sila.
and
Yeah,
you will get the certificate.
exactly. And just to tell you guys, especially since Cleveland mentioned about the pin, okay? Dito sa Ireland, guys, we don't have a physical card, just like the PRC card. We don't have that. So you will be given a certificate. That's a printable certificate
Yeah.
online. It will be emailed to you, or you can access that in your um, NMBI account. So you can also check that. So we don't have the physical card. How I wish we have. No, it would be nice as well. Just like we can keep it in our wallet. But unfortunately, we don't have that. But anyway, thank you so much sa ating 35,000 viewers. Is still holding
Yeah.
on. Nakakatawa.
Yeah. They reached 40 actually earlier. Anyway,
Yeah,
I'm
yeah.
checking the numbers as well.
I think we discussed a lot about clinical adaptation. So I think we need to just answer some queries here. Okay.
Yeah. Actually, there's a lot more to talk about on the adaptation, especially on the adaptation itself. Yeah. So
Uh,
basically, it's communication and it really how it goes on your area where you are.
yes. And
So
the experience is different. It's very relative to the candidate, to be honest. Or their experience might be different to us. And well, it boils down to like
yeah,
certain things,
yeah, there
like
are basic things
communication.
like
Be assertive, be humble. I know you are
yeah,
knowledgeable, guys. Because you know what, if you were very knowledgeable, if you were really good in your craft, it will show without you bragging that, hey, I know this, I know that. It will really show. I tell you guys, it will really show. Okay? You don't need to brag yourself kasi kaiinisan kayo. I'm telling you. Lalo na ng mga kapwa Pinoy. Joke lang.
And of course, you have to, yeah, orient yourself as well. So make a list. Nasa yan, parang I say parang estudyante, you're like a student again. But then again, not in a student in a way that you don't know anything.
Exactly.
You're
Yeah.
just assimilating your previous knowledge to the new knowledge that you're trying to learn.
That's a very good point. We are here, though our rate is a student, but we are not student. We are pre-registered nurses. So
Yeah.
just bear
So
that in mind.
the thing
Okay.
is, yeah. So sometimes students much know more, but it's the ways and means and what they are currently exposed to. But clinical wise, as a pre-registered nurse, you have your years of experience, especially with the management of the patient's illness and disease. So that's the student here is not well, not well yet versed with, or rather not yet exposed with. They're still being exposed to that, but
Mm,
they know the basics of the nursing.
yeah, yeah. And you know what, guys? Just to a friendly advice as well. I know Filipino nurses, we are very technical in a sense that we are using a lot of medical jargons, like medical terms and all that. But you know what?
Yeah,
Here, surprisingly, not everyone knows the medical term of certain things. Like for
yeah,
example, you're doing some documentation, they're not really familiar about certain things. Like for example, brewy and thrill with the AV fistula. They're not really, I don't know, maybe they forgot about it or they're not really exposed to that. But us nurses or Filipino nurses, medyo alam naman natin yun eh, di ba? Mga thrill, brewy, mga ganyan-ganyan. Mga hemiparesis, hemiplegia. Usually, some
Korotkoff
of
sound.
some of them some of them. So documentation has to be very concise, but very specific in a sense, but easy to understand. Ganon sila
Correct.
dito.
Yeah.
And,
Um, what will I say? Because I came directly from the Philippines, so we have this. My experience, like I keep repeating myself, which you know what Filipino usually does, especially when speaking to the foreigner, because at the back of my mind, we don't know if they are understanding us, but you're making sense. It's just that you just explaining too much. So just be
yes.
shorter, like keep it short and simple, really, and then
Uh,
they'll understand. And then they will tell you that I'm not understanding you. They will say that if you're not making any sense.
Yes, yes. And of course, us overseas nurses, we tend to have a difficulty understanding their accents as well. Like sometimes it's really difficult, and of course they're also feeling the same way. I'm pretty sure that sometimes they cannot understand our accents. That's why there's like some miscommunication or hindi kayo magkaintindihan talaga. But just really need to be assertive that hey, can you just repeat what you said, something like that. Because they understand. Sometimes you know what, guys. For example, you say that na sorry, I didn't get you. They will adjust
Yeah,
their accent right away, like easy to understand. Kasi ang hirap, guys. Ang hirap intindi ng
yeah,
Irish accent, to be honest with you. Hanggang ngayon, my God, magti 3 years na ako dito. Medyo, ha? Nangangapa pa rin ako
yeah,
sa accent nila. Depending na rin kung saan sila galing.
yeah.
Ah,
They will adjust how they talk to you. Like, sorry, I don't
exactly.
understand.
Have you
Can you
noticed
speak?
that? Di ba, no?
Yeah, especially if they really go into an full Irish accent. Like they're really small, fast, and their idioms.
Yeah, they're eating their words. The joke lang.
Yeah, their motors. Anyway,
Okay, okay,
um,
Mary Rose, Regatuelo. So, shoe requirements. So, yan, na-answer na natin yan. No clogs, no rubber shoes. Leather shoes is fine. Basta easily to wipe on. So, okay yan. Okay, Mark Joseph Diaz. After you pass, ayan, ang hospital po ba magbabayad ng registration sa Raymond and Nurse Cleveland?
it's reimbursement. So it's different in my cases. I've undergone agency. So may part doon na yung registration was reimbursed by the agency. Then the recognition part is reimbursed by the hospital. But once you pass,
Hmm, yeah.
once you have your pin,
Uh, pero sa
no,
amin,
no,
itong registration, I believe I paid for this. Di ba 140 to?
Oh,
145. 145, di ba?
yeah,
Tama
we
ba?
paid for that.
Oh,
We paid,
100.
yeah.
100 ata eh, no? No, no.
No, no,
100
it's
renewal
350 and
for the
then 100
recognition.
for the
But for the
recognition. So
registration,
it's
it's
145.
145, correct, yeah. Kasi yung renewal, 100 euros lang eh. So, 145. I believe I paid for this. Hindi siya kinover ng hospital namin. So, it's a case-to-case basis probably. I don't know.
So I paid for it, but the hospital reimbursed it because it's part of their,
Mm,
contract or on
yeah.
the
So, it really
with the.
depends, guys. So, tanungin nyo na lang yung inyong employer about this. Kay Abby Foral, hello. Hello, Sir Raymond Nurse Cleveland. May problema po ba kung walang experience sa OR pero yun ang nasa contract mo as in OR kahit dineclare mo sa interview na wala kang experience?
Well, it will be a challenge to you.
To be
That's it.
honest,
It's
yeah.
yeah. To be honest, I mean, you accepted the job offer, even though you don't have it, and it offered to you. So even you have to really work on it, like study how it works. If you have friends working on OR, it's a word by mouth, and making connections really. So
Mm,
you have to ask someone if they know some in the hospital that you will work with, if they know anyone from the OR, and maybe they can give you tips. It's not just right at the bat, na before you go there, everything is will you'll be you'll be surprised or like shocked of what's happening. So you have to prepare or equip yourself. Learn how OR works in UK, in
mm,
Ireland. Do
yeah.
some research and study. It's not just whatever the hospital will provide us,
Mm,
because you have to equip yourself to prepare yourself, not just whatever they teach us is fine, because that's what other people do.
mm,
So for you, if you want to pass and you don't want to get that shock and and give you a high rise of anxiety, you have to do your own
mm,
research. But then again, I think there will be no problem with that. But you'll have undergo your so just expect. I think the problem will be there will be you will not be able to cope up in the OR.
exactly.
So
And especially, guys, theater is complicated. I mean, in the sense that there's a lot of instruments that you need to learn, a lot of procedures that you need to, to grasp. So it will be a very big challenge on you. So I hope that you will be able to surpass this and with flying colors. But of
and
course, there's no impossible that you will pass the adaptation,
yeah.
especially.
So
Pero
it
challenge
depends.
talaga.
So just an add-on, Abby. So did you clarify where will you do your adaptation? Is it directly to OR or you will go to a ward first or unit?
Hmm. Kasi
That's the
kung diretso
question.
sa theater, it would be the assessment will be based on your performance. Like hindi kasi
Yeah,
kapag nasa adaptation ka, it's not like always observation. You will really have to be a member of the team. So it will be a challenge. So good luck on that. But of course, you will be able to make it once you prepare for
yeah.
it
You,
very
you
well.
have you have to sort it out or clarify it um with your hospital or your agency. Kasi in the end, ikaw magkakaproblema dyan. Paano kung di ka pumasa? 'Di ba?
Mm,
So, make sure na alam mo yung pupuntahan mo. Sometimes it's okay, like, okay, sige, sabak lang. But again, if you want to push with it, you prepare yourself, 'di ba?
mm,
Ano
mm,
bang ginagawa sa OR, pre-op, intra-op, post-op. You learn your hospital where you're going to. Find people who works in that hospital. Find people who works in the operating room in that hospital. That's how you prepare. So that once you get in there, meron ka ng kakilala, i-guide ka pa nila. Not yung bigla ka na lang dumating, walang nakakakilala sa'yo. It's, same scenario
yeah.
but two different backgrounds.
Correct. So yun. So best of luck to you, Abby. So Abby Bito, iba namang Abby to. So hi, Sir Raymond and Nurse Cleveland. Sir, I was hired po under Beaumont under colorectal ward. Any chances ng mga usual drugs na they are utilizing? I have no idea.
Okay. So sa colorectal ward, usually ano lang naman wala sa akin may mga foreign medication, so I just have to Google it. And then along the way, you'll just memorize it. So pag hindi mo alam, you just have
Mm,
to search. And then they will tell you, you just have to be safe. If you're not unsure, just ask the senior nurse. And then of course, wag naman pa ulit-ulit. Pag sinabi na sa'yo ng isang beses, tandaan mo na.
mm,
So
Saka
ano
be
pa, pain
just
medications, yeah. So,
uh,
mahilig sila dito sa MDA drugs. So, they really control like morphine,
Oxynor, Contin.
oxycontin. Those are the MDA drugs that it needs to be checked with another nurse.
Mm.
So, those are pain relievers. What else? So, hypertensive med, doxytocin. Those are the tablets one. Because, what, there's a lot actually. So, you will learn along the way. You don't
Yeah.
really have to know it right about. For me, I don't really know. I just learn it from there. I just there are some brands that you will rather um, generic names that you will be familiar.
Mm.
But mostly the names that I don't know are medication for pain and medication for depression and anxiety. Magugulat ka
Oo,
madami.
marami 'no?
I learned
Sertraline,
Librium. I
Xanax,
learned Librium here.
Librium,
For the yeah,
Diazoxide.
it's really
There's
really
a lot of
difficult.
medications, yeah.
Yeah,
But specific to the ward, it really depends, depending
depends.
talaga.
But
Oo.
yeah, kasi for us, napupull out din ako kasi kulang talaga ng nurses. Talking about nurses, i-share ko lang pala, Nurse Raymond. So there are nurses who's coming here who has application in the USA. So I have nothing against them actually. So the thing is, they have written the contract for 2 years. And the sad thing is they don't finish that once their decision from the US come and then they go to the US. What happened to my current hospital that I'm working with is that they put an embargo or ban to
Hmm.
us, or rather to the to the new nurses coming from the Philippines because of that. That's what they
Oh,
said.
really? Mm.
So it's just it's not, I'm not giving out, but it's prohibiting the opportunity
For other
for
nurses in this visa.
other Filipino nurses who wants to
Uh,
go to work in Ireland. But
uh,
that's just in our hospital because
uh,
definitely their hospital is still hiring.
yeah, I think
Just
so. Pero
sharing.
kasi merong ano eh, yung mga hospital may mga stamp for, I don't think there will be a problem with them going out of the country if they decide to do so. Pero
What
yung
I'm talking about,
mga
bag
bagong
nurses,
nurses,
yeah.
it's like like it's out of professionalism, I should
Yeah,
say. Or,
that's what happened. I think that's what they
uh,
said. That's what that's the talk of the marites
uh,
in the
sayang
hospital at
kasi,
the
di ba,
moment.
no? Oo. So ito kay Angela, Orayo. Wow, thank you so much, Nurse Raymond and Nurse Cleven. Sobrang helpful, nakaka-encourage po ang mga information na sinashare ninyo. Hope to meet you in person. Wow, hopefully. Yan. Kay Harold Puliran, ako, alam niyo, nanonood ba kayo
Ay,
ng Harold Puliran?
yeah, I watch it
YouTube
as
channel niya?
well. Yeah,
Oh my
kasi
God.
UK na siya.
Oo, very cinematic ang mga
Do you want
videos
to
niyo,
come back?
guys. So if you are like curious about UK naman, so yeah, kay Harold Puliran kayo pumunta.
Meron din siyang Ireland din. So how he
Yes,
transitioned from Ireland to UK. But
uh,
again, it's again personal. So for him, it's
yes,
watch his
very
videos. Yeah,
uh,
support, subscribes, like.
correct. So ito kay Yana, Anya, paano po pag nag-fail ng RCSI ng dalawa, ng twice? Di ka naman po pauwiin. Good question.
Okay. So here's how it goes. So actually once you failed, you are on your own. Because the hospital will not process you for like an HCA or anything like that. So you have either you have to make like if another hospital there or will process you as an HCA. So there's an agency watched on the YouTube blog of Nurse Raymond. It really helped. It was a really big help because I referred some of my adaptation who I know doing adaptation in our hospital who failed. So I refer them to this
They can really
agency, and
help
I think
in
I
fairness to
think
them.
they sort it out.
Hmm. Hmm. Kasi
So
ang ano
yeah,
dyan, guys, once you come here, you will be, of course, you will process your entry visa dito sa Ireland. And that's AWS visa. That's specific to what you're going to take, like RCSI or RCSI or the adaptation.
adaptation.
So
Yeah,
you will have the decision, the letter of what do you call that? Like a decision. It's not a
a typical
decision. Yeah, that
sorry,
letter.
letter from the justice. A
Yeah,
typical working Ireland.
you
Yeah,
it's specific there that you will have your adaptation in this certain hospital and you have your contact person there, etc. So RCSI is the same as well. So kapag hindi mo siya naipasa, wala na, because the main purpose of you coming here is to finish or to be successful on taking the aptitude test. So once you're finished with that, it's the end of the road for you, for that matter. Okay.
For
However,
that case, yeah. Pero hindi
yes.
ka naman nila pauwiin na sila yung magpapauwi sa'yo. Your visa is valid for 6 months. And Garda, the hospital will not inform Garda or anyone that, oh, this person did not pass and should go
Mm,
home. So you have the freedom within the 6 months period of your atypical working visa. So it's valid for 6 months. So you will receive a card as well, but it depends if you like pass or not, because within 3 months
6 months ba
they
yun,
will.
even ang AWS?
Yeah, six
Is it
months
6 to 12 weeks? Hindi ba 3 months? No.
3 months lang ba siya?
Oh,
No,
kasi
it's
I remember on my time,
well, of
I
course,
renewed it after 3 months, if I'm not mistaken.
after 3 months, yeah, you have to
And then
renew it
another
after
three
three
months, and then kapag
will be given.
once
It's
you have your critical skills stamp one, that's every
That's
year.
right. Yeah. So
Yeah.
again, yeah. So before you can have the card, I mean, because baka pwede silang makaano eh. Once you come here, you apply for the
Extension.
residence permit card for
Mm,
the stamp, atypical working. It's stamp one, but the needs contract and then valid for another 3 months.
mm,
So, kasi baka makapasok sila doon eh. So, right at the bat when you come here, you need to apply
mm.
for that. So, you will be
Yeah.
extended for another 3 months. For the visa, it's only valid for 3 months only.
Mm,
So, it depends if you will pass on with that 3 months or not. Or kasi doon mo malalaman
mm.
na kasi ongoing yun eh. So pwede ka pa ma-extend ng 6 months kung inaskaso mo na yung atypical working visa mo with the what's that? With the Irish residence permit. What's the name of the oh my god, the institution?
Alin?
Sa Burkey.
Ah, GNID.
The GNIB,
INI.
yeah, sorry.
Yeah, INIS. Yeah.
INIS, in INIS.
Yeah,
So
yeah.
that's what I mean. So if you did not process your INIS within 3 months, so you failed, you'll go home.
Mm,
Because
mm.
it depends if you will get the necessary documents for you to extend your
Renew it.
stay for another 3 months in the
Uh,
INIS.
but
So but if you were able to process it before you get the result of your RCSI or your um, adaptation, you have another 3 months.
mm,
You have until that residence permit expired. You
yeah.
have ways and means of how will you be able to stay here in Ireland,
Mm,
basically. So
uh,
one way is with Nurse Raymond's blog about this agency.
mm.
Baka
Oh, ba
naman may
i-check niyo na lang yung agency na 'yan. Hindi tayo paid
oo,
dun, eh.
oo, yeah. So check
Ah,
nyo na lang.
they
Watch
they're
his
they're
blog,
very
okay?
they're very helpful about, this
Yeah,
unfortunate situation. So
yeah.
yun. Ito kay Christine Hazel, I would like to ask if how much kaya ang pocket money na need dalhin para sa being safe na sa mga gagastusin during adaptation period. Thanks po. You know what, Christine, this varies, during my time and now after the pandemic. It's really, really different now. So
Mhm.
yeah, i-share sa'yo ni Cleven, magkano ang pocket money niya?
So there's an inflation now, so the rent is really high. So anyway, so sa akin actually when I came here I only have 300 euros just for the food, transpo and the internet. Kasi unlimited na 20 euros. So I can work with that until such time that I have a good salary. So when it comes to the time that I need to transfer to my apartment to a different location because the accommodation is only good for 6 weeks, that's the time that I pulled some strings. So I had a salary from my hospital. So I borrowed some money from my friends abroad. So I was able to secure an apartment with that. So basically, magkano lang yun? 300 euros lang for almost 6 weeks. I
Mm.
survived with that. Kung di ka mapili sa food, and then wag ka munang, you don't have to buy clothes yet. So just bring the
Yes.
clothes depending on
Season.
the weather season that you will be coming here. The rest you can buy it here. Um, Depende na lang kung maluho ka. And then yung mga gala, yung travel okay lang eh, libre naman eh. Mura lang yung yung public
Bus.
transportation. So, pili ka lang na malapit sa luwas, tsaka sa bus station. Ayun.
Mm, mm.
For us, it's me for the rest of 6 weeks, it's just bus. So I just concentrated first on my adaptation. But pero kung merong may mga gala, ganyan within the adaptation, hold off ka muna doon.
Oo.
So just
So
focus on your
mind your
adaptation.
budget. Mind your budget.
Major
Magkano ka
budget until
ah,
such time na sumahod ka na kung ano
puwede ka
yung
na
rate mo
mag-wall tax
talaga. Yeah,
afterwards.
or naka 1 month sahod ka na. So as early as before you come here, look in DAP IE, Rent IE, apply already. Depende sa'yo. Kasi for me, I think it's best, kasi sa Pinas sanay ako mag-isa, may sarili akong CR, wala akong kahati. I want that. So,
Lumipat ka
as
na ba?
far, hmm?
Lumipat ka na pala? Hindi ka na dun sa hinatid kita dati?
Hindi na, wala na ako doon. 6 weeks lang ako
Oh,
doon.
so saan ka na
Ah,
ngayon?
Malapit na ako sa hospital namin.
Oh,
So,
that's
malapit
good.
ako sa square. Yeah.
Studio
So,
apartment na nakuha mo?
studio apartment. So, 2 bedrooms, 2 bathrooms, dalawa lang kami.
Oh,
So,
that's
which is
oh,
good.
yeah, yeah, yeah.
Single din yung kasama ko. So,
Ah,
ang maganda pa, yung preceptor ko pa yung dating nakatira dito. So, high chance na nakuha. Sinabi ko na dun sa may-ari na Irish. Kaya, I was able to get the apartment.
that's
So,
good.
nagtaas sila 1,650 before, 170.50 ngayon. Pero mas syempre with the inflation, magtataas talaga. So others are looking for share. So 3 rooms, kung masaya kayo doon, 3 rooms tapos 1 bathroom. Yun,
Mm,
if you are willing to share the bathroom sa akin kasi I want my own, kapag uuwi ako, makakatulog ako, wala masyadong istorbo,
oo.
or wala masyadong
Kausap,
Ah,
no small
ka
talk.
not I like small talk, but ayoko nung parang sisitahin ka, "Oh, ganito, linis," ganyan. So, lalo na 'pag mas marami kasi 'pag mas marami medyo mas maraming
Pakikisamahan ano?
friction,
Ah,
pakikisamahan. But then we're good at that as Filipinos. But again, yun nga. So, as
hmm,
as much as possible nga kung kaya ko lang mag-isa, kakayanin naman kasi wala akong pamilya, I'm single, and it really depends on your priorities in later. Pero
hmm.
as of the moment, once you become an adaptation, just focus on adaptation. Yung pagkain, murang-mura lang. So, nasa sa'yo kung gusto mo magluto for
Magluto
like for
or
2 to 3
magbaon na lang.
days or pero ang mahal dito is yung take out nila or to go
Hmm,
nila kasi mahal ang service, people service, yun yung binabayaran mo actually. Food wise, it's so cheap. Like kung mahilig ka lang magluto and yung luto mo tatagal ng 2 to 3 days, solve ka na with just 10
hmm.
euros.
Yeah,
You're super
kayang-kaya
okay.
'yan actually.
Kasi lalo na yung lutong Pinoy, adobo, sinigang, it can last for 1 to 3 days.
Correct.
Yeah,
And this budget also depends on the location where you are going to work into. Like for
yeah,
example, if you will work in the countryside, definitely yung budget na 300 would be enough, you know what I mean? Pero dito sa Dublin kasi, and also by the way guys, depending na rin yung total budget nyo, depending na rin kung the employer will require you to pay the rent ahead of time and then they will reimburse it. So that should be added to your
it
budget,
depends.
or or they will provide it right away, like they will pay right away, kasi in my case ganun ang ginawa namin, so nagbayad ako and then they will reimburse it. Then I think I had like 600 euros na pocket money, and that's ano na yun, sobrang sobra na yun actually during that time, like 2 to 3
So
years ago.
yung the hospital provided a pre-departure pack and the agency will advise you as well na for them when I came here they said it's 2,500 euros, so that's how much it's 1,050, 100, so almost
50.
100,000 to 150,000, but for me I only came here with 300.
It's really, it depends. So
Ways
masyado
and
na
means. May kasama
exception
pang
na yung
gala yun. Yan. Thank you
exception
to
na
Sir
yun.
Raymond
Ah,
for the drive.
wala yun. So ganun yun guys, so just i-check nyo din yung lifestyle ninyo, how you really live your life, you know.
Yeah.
But anyway, it will be an adjustment when you come here.
Yeah.
So ito kay Nurse Rodolph, TV, hi sir, regarding COGS, good standing. Ask ko lang po, while on process kasi ng DL ko from NBI, ask me a new, ito na naman,
Oh.
certificate of good standing from abroad. Kasi it's already 6 months na. I submitted new one. need ko pa po ba mag-request before aalis after 3 months? Well, I would say not now. Siguro kapag nag-register ka na. Well,
So
that's my personal take actually.
for me, if are you going RCSI or adaptation, I think you have to renew if it's less than a month, like because how long does it take for you to take the decision, the certificate of good standing when you process it once you are here in Ireland? Gano ba katagal yun? Kasi kung ako, suggest ko 1 month before the expiration date, i-renew mo na para safe ka na. Kasi doon sa nangyari doon sa mga friends natin from ano nga ba yun? Bonsecourt? So, one of our friends there, like, when he went to recognition, they told him that, registration already, he needs to submit nga again the certificate of good standing kasi nga valid nga lang for 6 months.
Hmm.
So, he
Saka,
have to wait for that. So, nagkaroon pa siya ng issue to get his PIN. So, anyway, just to be safe, 1 month before the expiration of your certificate of good standing, renew it na. Para when it comes to your registration, wala ka ng problema. Unless pasok pa sa 6 months yung certificate of good standing mo pag nag-apply ka ng registration. Halimbawa, on the last month, doon ka na magre-register. You don't have to submit kasi pasok pa naman sa 6 months validity.
saka guys, itong request of certificate of good standing, it's not always happening Siguro case to case basis talaga. Pero yun nga kay Cleven, and then one of our friends also had the same experience. So personally, I'm not suggesting that you take this, yung certificate of good standing. Pero Cleveland has a good point na baka hanapin yun, and it takes a while for you to get it. Probably, if it's like not that expensive, why not process it right away? You know. So yan,
Kasi
kay
depending on sa hospital, kasi yung ibang hospital, nagulat din ako na they're not allowing you to work if you don't have it, which is that's the rule. Actually, doon din sa hospital ko. But my hospital is really, really nice. They just put you on annual leave. So that's a paid leave. So it took a week before I get my PIN actually. So
mm,
pero bayad yung one na wala akong ano. And then with the with the NMBI, it's taking time because for them it took them a month, diba?
so it's a
So
case to case basis talaga, guys.
yeah.
But it's good, that you have this kind of idea that probably NMI will ask you this and that. So ito kay M. Semilia. So may I ask po when is the best time to resign, no? Resignation na kagad. Does it affect kung mag-resign ka na 3 to 4 months prior to adaptation or RCSI? In my experience, guys, I resigned depending sa hospital to. Kung military hospital ka kasi, you have to render your resignation 2 to 3 months before the date of resignation. So I did that. So nag-file ako. I just confirmed with the agency kung kailan ba talaga mag-start yung adaptation, because I want to have a certain date. And also kapag may contract ka na and all that. So I confirmed that with the agency, and then when I had the confirmation, I resigned. I filed my resignation, and then umokay naman siya, thankfully. Umokay naman siya. Kasi kung
Ayun
hindi
lang.
ko na-delay siguro yun, hindi ko na alam kung nangyari, no?
So ayun na, it will really depend talaga kung kailan ang flight mo or lipad mo. Same with me. So actually I just have a good foresight and maybe good communication with the agency as well. So I was able to resign, sakto lang talaga. So nakapagpahinga pa ako ng 2 weeks to prepare before the flight. So
Mm.
nakapag-render ako, hindi ako awol or immediate resignation, which is I'm very,
Ah,
very thankful. From the Philippines, kasi usually sa Pilipinas,
exactly.
hindi
Madali
nila
lang eh.
sinasabi. So
Ah,
I just have a good foresight. So I asked the experience of the previous Filipinos went here. So sa tingin ko, ganito, ganyan. Basta
ah,
for me, once I had a contract and, you know,
exactly.
and I had
So,
a feeling na talagang
alis ka na
tuloy
talaga.
na, oo, tuloy na. So you have that gut feeling.
So
But then
you
again,
just
you
really need
must have,
uh, yeah, you
go,
just really need to communicate with your employer about this. Kasi syempre, it's your job that you will leave, and then another opportunity abroad. So you just really need to.
you have to weigh your options, what will be your fallback. Now, kung hindi mo ma-risk na mag-resign while waiting for this visa and everything, And then, of course, i-base mo dun sa previous experience ng iba. Ano bang current situation ng country mo? Um, so, kung meron ka ng contract and everything, visa na lang. So, I think it will be pushed kasi may contract ka na with your employer. So, it's just
Mm.
the visa when it will come. Kasi we
Ah,
have an adaptation nurse who's supposed to come with the same batch. She came in late because of the visa was not given right
right.
away.
Mm.
So, it's that kind of thing. But then again, you have to prepare yourself financially, mentally. You have a fallback as well. But
Mm.
definitely, ang kailangan mo lang ma-assure is talagang makakaalis ka.
Exactly. Yeah. So ito kay Harold Puliran, ito yung regarding dun sa visa. So after 3 months has to be converted to critical skills. Well, case to case, once you have your decision, no, your once you are deemed competent, and you have your registration. Depende din sa hospital yan eh. Critical skills, ano to, pinaprocess to once you have your NMBI PIN. So, and it takes a while pa yung critical skills. Hindi yan kapag in-apply ng hospital, it will be available right away.
It
No.
for us, it took us a month before we
Mm.
received the critical skills.
So you really have to check that. So ito kay Ditoy. Hi po, Nurse Raymond and Nurse Cleven. To Nurse Cleven, sa TUH po. Ano po step ng adaptation sa theater? Setup, sorry. Direct po ba sa theater mag-adaptation or i-assign po muna?
Okay, so that change is recent. So it's about, I think, more than 6 months. So just 6 months because we don't have adaptation on November and December. So January or I think February, new adaptation. Right at the bat, they went to theater. But before that, nag-ward muna sila. So the good part, you will already work, on your complacent area where you just have to adjust how their ways and means and the delivery of service there. The thing is that you'll not know what's happening on the wards or on the unit, how they do it there. So that's the advantage of the nurses who did the adaptation in the unit first before going to the theater. And the sad thing is that you cannot do overtime in a unit. Like you can only do overtime in theaters. Yun. So basically that's it. So they will teach you how they do it here. Kaya lang ang problema mo is yung competency baka ma-contest kasi may medication doon.
Hmm.
So first initially they will orient you, of course, and then they will ask you, are you happy to do this? So initially at the first day wala kang gagawin talaga. Observe lang unless they ask you to do something or they want to confirm to you that are you happy to do this. So masanay ka ng are you happy to do this. Yun yung sa Pilipino natin, pwede mo bang gawin to or kaya mo bang gawin to. So they say it, are you happy to do this? Yun yung way nila. So
Mm.
if you think that you can handle it, just say yes. But if you think you're not sure, just tell them, if you teach me how to do it, and I'll happy to do it. That's it. So,
Exactly.
turo mo muna sa akin, and then kung okay na ako, I can do it next time. So, I'm
Exactly.
not sure how can I do this. This is the first time. Are you happy to teach me how to do it? And the next time I'll do it by myself.
Mm.
That's it.
Mm.
Again, it's communication. So if you're having difficulty expressing yourself, practice is the key to
Practice.
success.
Yeah. Yeah. That's correct.
Hold on, I'll be back. Okay,
Yeah. Yeah. Go
you
ahead.
continue.
Go ahead. So yeah, we have a comment here from Ikra Junaid. Hello, Raymond and Cleveland from Pakistan.
Ayan,
Hi.
may amoy akong di ka aya-aya. Baka mamaya tatawa na lang ako bigla na hindi ko alam. Yan yung isa sa mga amoy na masasanay kayo dito sa Ireland. Habang naglalakad kayo sa daan, out of nowhere may mamoy kang ano.
Ang baho ba? Ang baho. So we have
Uh,
a viewer from Pakistan.
nagsisiga ng
Hello.
damo.
Oh, okay. So yun so those are our experience about clinical adaptation, and of course an overview and the experience of ours during the clinical adaptation. I hope you learned something from here. Okay, so 36,000 viewers. Nako, you keep holding on, ha? O yan,
I think there
i-greet
will
naman
be more
natin.
after this because the time frame, and
Yes,
then I think
yes,
we're talking more in English. You will have more
yes.
viewers.
So, kay Merlina Fernandez, nanay ko to, say hi.
Hey, hello po, tita.
Hello, ma.
Kamusta po?
Ah, nasa bahay namin siya ngayon.
Ah,
Anyway, so
punta
yun,
po kayo dito.
oo nga, so ipaprocess namin yan, yung visit visa. And then I'll make a vlog about that. Hopefully
Yeah.
soon. Hopefully. So yun, um, any advice, few more advice or pieces of advice pala, that you can give to our viewers about clinical adaptation? There's Cleveland. Before I let you go,
Oh, yeah. Oh my God, we're all we beat
yeah, almost 2 hours
two
now.
hours so we're talking to yeah, we have to
Yeah,
keep it short and simple. Anyway, you can message me or Nurse Raymond if you have any questions. You can look at Cleveland or John Cleveland Garcia
John
or
Cleveland
yeah,
Garcia.
yeah.
Okay.
I'll just share my Facebook on the chat there.
Yes, yes.
Anyway, my advice. So you have to prepare. I mean, they don't want it's good that you're being spoon fed, but you have to prepare yourself, especially for my Filipino countrymen. I mean, you have to do your research, you have to prepare where you are going, especially me because I just came from the Philippines. You have to know where you are going, what country are you going, what are their norms and their culture and how they speak. And then just be friendly, attitude be nice, have an open mind, confidence, and strong will. Because there will be a time that you feel low, but you have to have a strong heart. And always ask for support. Look for friends, colleagues that will provide support to you along the way. Because they will never, leave you alone. Again, nursing is not a profession that you have to work alone. It's a profession that you work with everyone. So it's not just only you. You have colleagues, you have the other healthcare providers, you have the multidisciplinary team. So just you have to learn how to communicate with them. That's the main thing. Communication is the key in order for you to adapt.
Hmm. Well, thank you so much, Cleveland. Ako naman, wala bang ano yan? No, ay, thank you. Wala.
And I thank you.
Thank you so much, Cleveland. Last question from Hazel. So tips for show to watch just to familiar with the accent. You know what? There's no like many movies using Irish accent to be honest with you. But if you are familiar with Saoirse Ronan, so she's one of the good actresses, actresses. So you can watch her movies. So sometimes she's using Irish accent, but most of the time no, very very like I don't know certain movie to be honest using Irish accent.
Yeah. So what I've noticed is that their voice of sound is really small. They're in the southern part of Ireland, because different from the northern and the south. But in the southern part, what I usually notice is their O's. So have you been to the toilet? Have you used the loo? Have you opened your bowels? So
Mm,
there's something on the intonation on the words
mm,
that's make it difficult to understand sometimes, especially if it's they speak fast. What else? Here they use the British. They use the British language or other words. So for the Philippines, we don't use usually like esophageal. So the pronunciation
mm,
esophageal. So unlike us, it's esophageal e right away. So there's those kind of varieties, and then also you're not we be working with Irish. You also work with Indians and also Africans. So they have a different accent as well. So
mm.
I remember it was my first day during the handovers, and the one that was handovering was an African. She has really I
Thick
having a
accent
hard time.
probably.
Yeah,
Mm,
different accents, so I'm not understanding sound of the word even though it's English, but I try my best like to write whatever I understand. That's
mm,
it. So
yeah, you
don't be
just need to
scared.
verify, you need to verify with them. I say different counties here they have different accents, and depending on their age as well, the younger
Yeah.
the harder the accent, like the thicker the accent they have, and the older they have the strong. native or not native but county accent. So yeah,
Yeah, if
it's really.
they are really born and raised in Ireland, like they haven't went to another country, so you'll be
Ah, ito
able
maganda.
to, yeah,
Yeah. So ito, kay Loreto Jr. So you can watch Irish movies for free online. Yeah. So you can
yeah,
do
they're
that. You can do
excellent.
that. But
Yes, you can do that as well. Yeah,
yeah, it's kind of different, whenever you speak to them in person rather than in the movies, because in the movies I think they're adjusting their accent as well for
so
a lot of
for
people to
people to
understand.
understand,
But
yeah.
in person it's kind of challenging, but I'm pretty sure you will be able to do that or to understand that. Okay, Cleveland, thank you so much. Huh?
Thank you, Nurse
Thank you so
Raymond.
much
Thank
for
you
your
for the
time.
opportunity. Yeah,
Yes, always, always. I'll see you next time again.
whenever, yeah,
Yeah, whenever you're
you,
free and you're here in Ireland.
yes,
I hope you enjoy your
definitely.
vacation to
I
Edinburgh
will
the next few
definitely.
days.
I
Enjoy,
plan it
and
for months.
yeah, and make sure to come back. Okay.
Yeah, sure. I will come back definitely.
Yeah,
Sinusulit ko lang
Cleveland.
yung UK visa
Yeah,
kasi
that.
6 months lang
Yeah.
yung in-apply ko.
Oh, exactly. Okay. Yeah.
Malapit na matapos.
Cleveland, thank you
Thank,
so much once again for your time, and I'll see you next time. Okay. I'm gonna let you
okay,
go now.
bye-bye.
Okay. God bless you. Bye bye. Okay, guys, so that's Nurse Cleven, and we discussed about clinical adaptation. And thank you for your time, guys. And I hope that you learned a lot from this live stream. Okay, so we already discussed about RCSI aptitude test with Pete Aldwin. So I hope you watch that video as well, especially if you will be um, going to have the adaptation in the future. And then this clinical adaptation naman with Nurse Cleveland. Okay, thank you so much, guys. Thank you so much for your time, and I hope to see you next time. Okay, and if you haven't subscribed yet, please do so. Subscribe to my YouTube channel and follow my Facebook page, Nurse Raymond 123. Okay, is that okay? Say bye.
Bye. Bye.
Bye, guys. God bless you guys. Bye bye.